Hi, my name is Dr. Mugisha Keruzi. I'm a cardiovascular surgeon specialist working at a university hospital and private institution. Today, I would like to talk about the risks and the success associated uh, with open heart surgery or minimally invasive cardiac surgery. Um, the open heart surgery is associated with many risks, and these are risks is because the heart surgery, it does not involve only the heart, but it involves the whole structure of the body, and this includes the situation of other organs in the body. And most of the complications associated with the heart surgery are the other organ related complication, and these complications are pulmonary complication. I mean, the after the operation, the patient might experience the low um, uh, breathing complication after the operation, because this patient, they might suffer some lung infection, which may result into low lung capacity. And sometimes, because of the pain, the patient might not breathe properly after the operation, and this may result into accumulation of fluids in the lungs and cause this type of complication. But the other complication may include the renal complications, which are the kidney complications. Some patients may suffer the transient kidney injuries after the operation, and that's why after the operation we advise most patients to drink as much water as they can, and we infuse them with much more fluid to make sure that their kidneys are well protected. Or sometimes we provide them with the antidiuretic drugs to make sure that we minimize that risk of getting into the acute renal failure. But sometimes we do have the liver complications. It is another component of after open heart surgery, whereby the patient might suffer the transient ischemic liver injury, which result into the acute liver injury, and therefore after the operation we keep their blood pressure very high to make sure that we protect their liver. The other complication might be the peripheral vessel complications, because we do use these peripheral vessels for performing these type of surgeries, especially in minimal invasive cardiac surgery. While in open heart surgery, we use the central great vessels, whereby these great vessels may be affected in one way or another with either rupture uh, or narrowing of these vessels after the operation, and therefore these are other cardiac related complications. The other risk of open heart surgery might include the infection. And in open heart surgery, most of the time it might be the wound infection or steno wound infection, which is a very, very major complication after opening cardiac surgery, because when the sternum bone suffer infection, which we call the mediastinitis, the recovery is much more very, very long, and the patient may require to stay in a hospital for more than a month to receive therapy after he has suffered the sternum infection. And the other complication might be the neurologic complication, which I mean the complication associated with the vessels feeding the brain. If these vessels are not fully open, or they do have some plaques, whereby these plaques might get into the brain and cause effects into different parts of the brain, and this may result into different problems, or which are related to stroke or bleeding, or related to stroke or bleeding, because during cardiac surgery we do give the blood thinner to the patients to perform this type of surgeries, because we connect them to the lung heart machine. We have to provide them with a blood thinner, and this might result into bleeding in some patients who are very prompt to bleeding. And so this is another complication which might be associated with the heart open heart surgery. The success of both minimal invasive cardiac surgery and open heart surgery is very, very high in patients without other related heart problems. The risk of this operation is about 1 to 3%, but this risk may increase to about 10 to 15% if the patient have other organs associated problems, which means if a patient has the kidney problems or the liver problems or the neurological problems or the peripheral vessel problem, the complications of these structures may increase the risk of the operation up to 3 to 5 times. The most common changes that most of the patients, the challenges most of the patients they face during the operation is, being active and performing physiotherapy, because these patients are for the operation. We expect them to be more active, and which facilitate their recovery and also aid them to return to their normal social life activities in a very short period of time. These patients might face this problem by, keep lying on their beds, which result into other different type of problems. So this is the challenge of which most of the patient may suffer, but also they may suffer the social problems, like in society, especially those people who have undergone open heart surgery. They might not feel much comfortable with a very long incision on their chest, and this may affect them psychologically. And that's why we perform minimal invasive cardiac surgery to also aid these patients to have better feeling after the operation, which enable them to have very good social well-being and return back to their normal life after the operation. Minimal invasive cardiac surgery does not prevent the future of these patients to undergo other type of surgeries, but minimal invasive cardiac surgery, it assists or it facilitate performing the secondary operations much more easily compared to the open heart surgery, because during open heart surgery, you fully open the pericardium, and you enter through different heart structures, which may affect you know this second operation, because there will be much more adhesions during the second operation. We call the redo operations, and the heart itself might be adhered to the sternum structure, which might be affected during reopening of the heart during the second operation, which may cause injuries and result into bleeding, and this bleeding might result into different type of complications. But this minimal invasive cardiac surgery, because we perform very small incision during the redo operations, the second operation might be performed much more easily, because we specifically open a very small space of the pericardium, and we reach a very specific area where we are going to perform operation, instead of opening the whole pericardium of the heart, which also affect the second operation.